At Florida Senior Consulting, we have been launching videos online for a brief period of time, and questions are starting to come into our company. And I want you to know that if you have a question or a concern about your situation or a loved one's situation, we welcome your questions. Feel free to write us online. Feel free to call us and ask for me personally. My name is Scott Miller. I'm the CEO of the company. But the questions come from all different walks of life. One of the questions I was just recently asked was about an acute onset of dementia that essentially occurred overnight. A gentleman was watching a football game and suddenly started to forget where he was, what had happened the day before, had a lack of understanding, and then a bit of agitation when it was brought up to him. First of all, the agitation for memory or the absence of memory is a very, very common reaction. But with this particular case, when you hear about an acute onset of dementia or memory loss, there's a variety of factors and not always easy to explain, and obviously the role of a clinician to formally explain or understand. But this particular scenario that we were asked the question about leaves me think about a variety of things. One is vascular dementia. Vascular dementia is when blood flow is cut off to a certain part of the brain or is inhibited because of a blockage somewhere in our body. It can cause deficits in memory. They can be short-term. The other thought is a TIA or a mini stroke that also can create the same type of scenario. My reaction to the person asking the question is the very first thing that you should do is call your primary care physician or go to an emergency room. Nothing to take lightly. This could be a serious situation or the sign of something serious to come. The ultimate diagnosis of a scenario like that would come from a neurologist. And a neurologist would have to do a full-blown evaluation, mini cognitive assessment, and understand the entire situation before they could come up with a formal diagnosis. But we're happy to help guide in those situations. We can hear the information, we understand a lot of the clinical aspects of what's going on, and then we can refer out and tell you who you should be talking to and the best way to address that particular situation.